Although more women deal with vein disease than men, it's still a problem for both. It's Men's Health Awareness Month, and our next guest wants men to stop ignoring issues like tired, achy legs and bulging veins and get it fixed before the disease is in the advanced stages. Dr. Tony Reincke with Reincke Vein Center says early treatment, like a lot of things, can help reduce progression and restore comfortable function. Good morning.
Good morning.
All right, so oftentimes we hear that it's so hard to get them to the doctor's office, and you want to make sure that they do that so they can take care of issues and get it out of the way.
Yes, ma'am. It's really important, I think, because there's some stereotypes associated with vein disease, like it's just women or it's just cosmetic, it's about the way it looks, and it's absolutely not.
Yeah.
So we want to get the word out there that men are affected as well as women. About 40% men, 60% women.
All right. Another stereotype, which actually was not a stereotype just a little while ago, is that it's way too aggressive and too painful to get taken care of. At one time, this thing called vein stripping was a big process.
That's right. Luckily, we're not doing, or most of us are not doing kind of that barbaric procedure anymore. Vein stripping required anesthesia, operating room, general surgery, and a 6-week recovery time. Now, I'm an interventional radiologist. All procedures are done in the office and patients are back to their normal activities the same day. There's no downtime.
Yeah, literally. You go in there. First of all, when it comes to the diagnosis part, you can diagnose fairly quickly and that's painless, right?
Yes, ma'am. It's a screening ultrasound that we can do. If I decide then that a patient needs a diagnostic ultrasound, that's done here in the office. It takes about maybe 30 or 40 minutes. I review the results and then talk to the patients about those results the same day.
Yeah, and then there's that catheter procedure you talked about, little bitty insertion of a needle, and you go in to shut down those problem veins. And I can hear people now going, "You shut off a vein? Is that dangerous?" Well, we have plenty.
That's correct. There's hundreds of veins. We would never treat that many, but I take the vein that's diseased, essentially stretched out, has backward blood flow. I shut it down. I reroute blood. We get blood going the correct way, and then that helps with symptomatic improvement for patients.
Yeah, you say blood going the right way. Back up and explain to us what is happening when someone has vein disease.
Well, the vein gets stretched out over time, and the most common risk factor for that is genetic. So somebody in your family. There's multiple other risk factors like an occupation where you sit or stand a lot, obesity, age, even pregnancies for women. So those things contribute to stretching out of the veins. The valves inside the veins, which are like little doors, they no longer close, and that allows blood to back up and it goes towards the feet. So you're creating this high pressure in the tissues that is not normal and leads to patients' symptoms.
Yeah, we talked about some of those symptoms earlier, and I can't tell you how many times people have gone to get a symptom treated. I have a friend right now dealing with the purple spots on her legs, the flakiness of the skin, and some bulging veins. She's just like, well, I probably need to go talk to my dermatologist. Well, not necessarily, right? And then someone else who is saying, my legs are tired. Is it a muscular issue? Well, no, it all goes back to vein disease. Let's go through some of those other symptoms that people have a tendency to want to medicate or treat the symptoms, but not understanding to get to the root of the problem.
Yeah, so another really common one, which can be caused by multiple factors, but it may indicate vein disease, is swelling. Restless legs is another one, and cramping of the legs. So we just have to sit down, have a thorough discussion, look at all their medical history, medications, past surgeries, et cetera, and then determine, is it indicated to move forward with an ultrasound and then ultimately procedures.
Yeah, because you mentioned restless leg, and I remember seeing an ad for medication to address restless leg. Well, that again is addressing the symptom, not the problem. So come in first and see if you can just get rid of the whole issue. All right, getting evaluated. The process you said was very simple. One thing that stops a lot of people in their tracks is they wonder about the cost.
Yeah, it does me too. That's why the whole team make sure that every single patient that comes in knows any amount or financial responsibility that they would owe before even getting an ultrasound. We don't want any patient to be surprised or get a financial surprise about any part or any step of the process.
That's one of the things that makes you different, because that gets a lot of people off track when they get bills later and go, what happened? I thought this is what I was supposed to pay. So let me just say thank you for that. One of the other things that makes you different, Dr. Reincke, for you, this is not a business. This is truly a calling, and you want to work directly with those patients. You work directly with your patients, even to the point where you give them your cell phone, and you'll meet them on the weekend if you need to.
Yes, in fact, I work every Saturday. It's not posted, but I work every Saturday. I do cases. And if there's a need, which is not very often, most of the time, honestly, it's just peace of mind for patients. But if I need to, absolutely, I come in. And I do love what I do. I've been in healthcare for a long time.
Yeah. Dr. Reincke, thank you so much for joining us this morning.
Thank you for having me.
All right. Reincke Vein Center has a special offer. Mention Great Day Houston to receive a free consultation. Call them at 281-394-4446. Again, that's 281-394-4446, or visit their website at reinckeVeinCenter.com.